If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner. Welcome to Ask the Doctor. This series was created to assist you in understanding medical issues so you can take charge of your own health. This is our 8th season and we are airing once a week. This is a live call-in show, so have your phones nearby. In case you don't get through, you can still submit your questions via the internet. Visit netny.net/askthedoctor or let me know what's on your mind. I'll take those questions for future discussions. For this episode, I have Dr. Anthony Saleh, pulmonary attending at New York Methodist Hospital. Then I have Dr. Parvin Zawahir, internal medicine, attending also at New York Methodist Hospital. And lastly, we have Dr. Bruce Garner, chief of rheumatology at Lutheran Medical Center. Welcome. Well, we have a lot of things going on in the past month, and we're going to get to the news. But before we get to the news, we've got to get to that part where we keep our brain sharp. And that's the brain teaser by the puzzle master, Dr. Eugene Hagawara. He'll be back with us live later on in the year. But for now, let's look at this question. You may hear the word pronounced incorrectly in the English language. For example, extraordinary. That's not correct. It should be extraordinary. Well, this question says, what word in the English language is always pronounced incorrectly? So we know that it's extraordinary, extraordinary. That's not always incorrectly. Which word in the English language is always pronounced incorrectly? We look forward to your calls, and remember, you get that all-important plaque, which is coveted by many in this city. So now let's get to the news. In the news, we've been talking about swine flu incessantly for the past month, and is it going to be bye-bye, so long farewell, or will we see it again in September? And that's something that nobody knows for a fact. We do know that we lucked out with the first episode, this first episode in March and April, where the swine flu was not that bad. Unfortunately, some people did die, but actually not as much as in the regular flu season, in which 36,000 people die a year from the regular flu. So the swine flu passed, and the only fear is now it heads to the southern hemisphere where they're going to experience winter, and it could mutate. And that means it could change and become much more serious virus, or it could also mutate and become a less serious virus. So we're not going to really know until September. I think one of the things our government has to start doing is investing money into developing vaccines so that we'll have a way to prevent people from getting very sick from this. Right now, our vaccine process is over 50 or 60 years old. It takes several months, up to 8 months to produce it. So people, we really have to invest. That's what I believe that the government should be investing in right now, rather than plans which probably won't work if we get overwhelmed with a serious epidemic. We're talking also about eating right and seeing more than the light. And this talks about macular degeneration, the leading cause of blindness in those over the age of 65 in this country. And how do you prevent that? Well, one may be in the fats that you eat. Avoid saturated fats. Take olive oil, take soy and other products that are heart healthy, and you'll also have healthy sight. So that's important. The other thing is, can vitamins undo the good effects of exercising? And we've had several studies which have shown that vitamins may actually decrease one's lifespan. But this study is really scary because it shows that if you take vitamin C and E after you exercise, that it actually may decrease the body's ability to fight off these free radicals and oxidants which cause aging and cancer and other diseases. Seems the best thing to do? Eat fruit and vegetables, just like your mother told you. Stay away from the supplement vitamins. Do it naturally, and you give the body the best chance to be healthy. Finally, unfortunately, 10% of the country is unemployed right now. This means 10% have the shock of losing their job, being humiliated, having psychological problems, and we're not really helping them to transition into this new experience, which many haven't had. And we're seeing that there's a 100% increase in diabetes, high blood pressure, and heart disease in the year after somebody has been let go. So it's something that we have to address. I mean, we've had psychological problems where unfortunately some man went on a shooting rampage earlier this year who had lost his job. We can't have this happening, so we really have to invest into this transition period, put the preventive maintenance in effect before we have a problem. So basically, that's what's been going on in the news. I'm really honored tonight to have the guests that we do have. And Dr. Parvin, and the last name?
Zawahir.
Zawahir. It's a beautiful name. And where was the origin of that name?
The first name is Persian, and
Persian.
the last name is Arabic.
And the first name means?
Star.
Star. And you come from a big medical family, I
Yes.
understand.
Yeah, a lot of doctors in the family.
Mother?
Both my parents, my sisters, are all physicians.
Was it unusual, you think, at your mother's time to become a doctor? I mean, kind of, I think.
It was less unusual in India. My parents come from India, and there, at the time when my parents studied, 50% of the class was women, 50% men. That didn't happen in this country until I was in medical school.
I wish I would have been in that class. I had 2 women. I got to give me the address. So, and I know you're a teacher at New York Methodist Hospital, which, tell us about some of the, who you teach, how you do that.
I supervise the residents who are in training, so they've finished their medical school and they are practicing in the hospital, but they're in training. So I supervise them in taking care of patients in the inpatient setting, and also I supervise them in the clinic where we see all our outpatients. So it's a large teaching program at Methodist. So.
And being a teaching program is a plus for patients who are coming in because you have the supervision of doctors and you have layers of people who are checking and who know new research and so on. So it's great that you're with us. And as a segue to our next guest, you told me the #1 best teacher in New York Methodist Hospital is sitting right next to you, to your left.
Dr. Saleh takes care of all our students.
Well, the check is in the mail. Thank you.
But Dr. Saleh, it's such a pleasure to have you here. And let me just give the audience somewhat. Dr. Saleh is on the Board of Trustees. He's the youngest member. If you've ever seen the Board of Trustees, they're learned men with many years of experience. And Dr. Saleh brings life to more life to this organization.
It's very nice, but I'd like to thank you for, ever since you've been in Methodist Hospital, the radiology department really has been revolutionized, and the camaraderie that we've developed is so nice. It's great being with you.
It's great, and all Yankee fans on the panel, by the way. So,
thank God.
And we're having a tough start, but what do you think? We got a chance?
I think it's early. I think we have another 130 games to go, so don't panic.
Well, I've got the Yankees along with my son-in-law, who you met on the previous show, Danny. Yes. We have the Yankees, but we got guys like PUs, if you know what I'm talking about. So,
you still have M. Rivera, don't worry.
As long as I got 42.
Right.
Thanks a lot. And then, of course, last but not least, somebody with the same last name, with the same parents as my brother, Dr. Bruce Garner, who, tell us a little bit what you like about Brooklyn, why you don't move out to the island.
I wouldn't even consider moving out to the island. As a matter of fact, on our first date, I said to my wife, who at the time obviously thought I was crazy. Now she still thinks I'm crazy after 17 years of marriage, but it's a fondness. I said to her on the first date, if we get married, we have to move to Brooklyn. And she said, okay. And we live in Prospect Park South, which you live nearby. It's a beautiful neighborhood. There is nothing in the world like Brooklyn. The best people in the world, the best food in the world. I know you always ask everybody, what's your favorite restaurant? All my patients who are loyal viewers of the show love that part. They wanted you to publish a book instead of Zagat's, Garner's ratings for restaurants. But I'm not doing a good job describing it because it's indescribable. There's no place on earth like Brooklyn. This is where I'm from. This is where I want to be.
And this is a passion. And of course, we love Queens. We love the Bronx, Manhattan, Staten Island, our viewers. And it's always nice to run into viewers on the street and the pharmacy. I ran into someone in the grocery store. And we hope that you really enjoy the show and call in. Now, again, call in. That's the key. We depend upon you for the calls to make the show interesting. So our phone number is 718-499-6101. You can call and talk about lung disease, internal medicine, or rheumatology. We're taking a short break, and when we come back, we're going right to the phone. So the number is 718-499-6101. We'll be right back. Welcome back, and let's go right to our first call. That's Philip.
Yes.
Philip, how are you?
Good.
Where are you calling us from?
I'm calling you from Marine Park, Brooklyn.
Oh, very nice, very nice. You're a big fan of the show?
No, I just happened to watch it twice. This is my second time.
You and my wife. What can we do? What can we do for you tonight?
Well, let's put it this way. I went to a lung doctor because I had, about 7 years ago, I had a bypass surgery, okay? And since I had that, I've had shortness of breath. They said I had a heart attack while undergoing the surgery. I never had one prior to that. Anyway, and I thought it was from having emphysema, they said it was. Okay? So I went to a lung specialist in LICH, and he looked me over thinking that I may have COPD, is it? And I didn't. He said, no, you don't have it. He says,
so LICH, Long Island College Hospital, COPD,
right.
Chronic lung disease, chronic obstructive pulmonary disease.
Yeah, that's
Okay.
what he thought I might have. After me taking the breathing test, it turns out I did not have that. And he doesn't think I have emphysema either. He sent me, well, I haven't gone yet, I'm due to go Wednesday, for an echocardiogram, and he said it has something to do with the ejection power of the heart. And he said that's curable, not curable, but it's treatable with medication, none of which I'm taking now, I might add.
So,
And
Philip,
that's
I'm
what-
going to ask Dr. Saleh to comment on this.
Yes, please.
Hi, Philip. Hope you're feeling well. Philip,
am.
Good. Philip, the fact that you had heart surgery in the past, certainly it's fortunate that they were able to bypass the obstruction, but sometimes your heart can be damaged or injured. And what the ejection fraction is going to tell you is how strong your heart is beating. The heart, as it sits in the chest, is a pump, really, and it pumps blood to the other organs. And one of the reasons you can get shortness of breath is if the pump is not working well. Now, Philip, are you a former smoker?
Only for 47 years.
Only for 47
Yeah.
years. Well, fortunately, thank God you saw the light. So you certainly, even though your breathing test was normal, you may be short of breath for a couple of different reasons. I think your doctor was dead on target by getting an echocardiogram. I think that'll be a very helpful test. And if that comes back normal, then he may want to do some other tests of your lungs, perhaps a CAT scan, perhaps a stress test or something to try to get to the bottom of why you're short of breath.
Okay, thank you very much.
I hope that helps
You're
you.
welcome.
Now, we're going to go to Tim. Tim on line 2. Hi, Tim.
Yeah,
Hi, where are you calling from?
Flushing, Queens.
Flushing, Queens. You Met fan, too?
Oh, hold on there. Wait, I want to take off the headset.
Oh, this is professional caller. This is a headset on here. Tim,
Yeah, I'm calling from Flushing, Queens.
very nice to have you aboard. Were you near the hospital at all, at Flushing?
Yeah, not too far away.
What do you think of that Parkside restaurant?
I know about Jan's. I don't know about the restaurant.
Have you been to the one in Jackson Heights?
No, they used to have one across the street from downtown Flushing, the Queens Public Library
Yeah, yeah.
by the Prospect Theater.
That's a shame, right? No more kitchen sinks, nothing like that?
You're right about that.
So I'm going to give you a chance before we get to your question. Did you hear Dr. Hagawara's brain question of the week?
No, I didn't.
I'm going to give you a chance now. You ready?
Go ahead.
Get the headsets on. Okay. What word in the English language is always pronounced incorrectly?
Always pronounced incorrectly?
Yeah. You think about that while we're discussing. What can I do for you?
Okay, this is the only way I can say it. I have a small garbage can lined with paper, and when I spit into it, right, as the days go by, all of a sudden the spit turns into a white substance like you would see in a Petri dish, and then a couple of days later it turns into a deep orange. I know it's crazy. I'm just wondering what it might be.
I apologize to those eating supper right now. But,
sorry.
Dr. Parvin, Zawahir?
Zawahir.
Say that again for the audience. Zawahir.
Zawahir.
Zawahir. That's also Persian, the second
I
one?
thought this
no,
be
it's
the
not.
lung guy.
But anyway,
just have
Dr. Parvin is going to help us.
I have a question. Are you saying over the course of the day?
No, a
what you
couple of
spit-
days.
So it's been sitting there a few days and then it changes color?
Right, it changes into a whitish color like you would see in a Petri dish.
Uh-huh.
And then all of a sudden, a couple of days go by, and then it changes into like a deep orange, like you would see that orange on Halloween.
Okay. I mean, I'm not too sure of the science behind this, but when you cough things up, there's mucus, and your phlegm is made up of the things that your body is trying to expel, the
Right.
things that you don't want in your body. So if that's what you're spitting up, it's a sticky substance because it's meant to clean out your lungs. And so if it's sitting there in your garbage can, it's probably collecting what's in the air and also reacting with the air, because it's a different environment than what it is inside your lungs. So you are going to see certain chemical reactions, I'm sure, that can change the color of it, and also just attracting the dirt that's in the air around us.
Tim, thanks. I think you must be big hit at parties. But anyway, thanks a lot, and I hope that has helped you. All right? Take care. Okay, let's go to Philip now. To Linda. Linda. Hi, Linda.
Hi.
Hi, where are you calling us from?
New York City.
Oh, Manhattan.
Yes.
That's great. We don't get, excuse me, we don't get that many callers from Manhattan. Which part are you calling from?
Oh, the Lower East Side.
Very nice. Near the FDR Drive?
Yes.
That grand houses around there?
Yes, that's it.
Beautiful, beautiful. I could tell the accent that picked it up right away.
Okay, thank you.
What can we do for you?
Okay, on Mother's Day, my mother tripped in the street. She's 77, and we went to the emergency room. They said she has a fracture humerus head / closed. And they said on the left shoulder she has an immobile sling, and they said within 6 to 8 weeks, it's not serious. She'll be better. Now it's a little. I'm taking it back to the doctor for a follow-up next week. It's a teeny weeny bit black and blue. We have
teeny weeny.
Okay, that's my mother. So we have ice on it, and she was taking Percodin, I think, for once every 6 hours, but she don't like it no more. So we.
You want to? Does mother want to talk?
Ma, you want to talk to him? He said. You want to go on television? No, she don't. And now she doesn't want to take the pill because she feels a little dizzy.
What's her name?
Oh, Carmela.
Carmela.
Okay.
Okay, I'm going to ask Dr. Garner to comment on this fracture of the humerus head, which is up here.
You know, it's very interesting.
Yes.
How bad was the fall?
Oh, she fell down, and on the sidewalk. On the sidewalk, she tripped because she went forward. She scratched her nose, her head in the front, and they did all X-rays. They did about, I'd say about 13 X-rays. They said it's not that bad, but you know she has a sling on.
The reason I'm asking, and Carmela, hello to you. I hear you in the background there. The reason I'm asking how bad the fall was when somebody falls. When you see kids playing, they fall all the time, but they don't break their bones. As you get older, your bones become what we call osteoporotic. They become weaker.
Yeah.
And if you have a fall and you break your bone on a small fall, something where you wouldn't normally expect it, that's a sign that your mother may have osteoporosis. From what you're telling me, it's going to heal nicely.
Nicely healing.
But this is a clue that both you and your mother, remember, were you listening when we spoke to Joanne, the other caller? Okay.
Yes.
Remember we said osteoarthritis is hereditary. Well, osteoporosis, which is weak bones, which occurs with greater frequency in women after the menopause, runs in families also.
So we need a bone density test.
You got it. Your mother should be getting a bone density test.
Okay.
And at this point, to help her heal, she should at least be on calcium with vitamin D. If there are no contraindications, if she never had a kidney stone, she doesn't have any glandular problems, parathyroid problems. And she should find out from a doctor whether or not she needs something like Fosamax or Actonella or Boniva.
So, Dr. Parvin, do you see a lot of these patients that you suspect have osteoporosis, and what do you do when you...
Absolutely. I mean, we screen our older women over the age of 65. We start earlier if they have any risk factors. And the main risk factors which you need to watch out for are family history, like Dr. Garner mentioned, smoking, small frame, unlike osteoarthritis with excess weight. Women who are smaller get osteoporosis. And white or Asian race.
We're Italian.
You're Italian.
She never smoked in her life. She never took a drink.
Well, that's wonderful, but it is worthwhile, like Dr. Garner was saying, if you have an unusual fracture, to get checked for it.
Yes. Doctor, what is a fracture humerus head / closed? I don't even know what that means.
Well, it's just kind of a when it's fractured, the humeral head is up here in the shoulder.
On the, yes.
And that means closed, that the bone is not sticking out, that there's no direct injury like a laceration or a wound in the skin, that you could actually see the bone. So her bone you can see, and these usually heal well with the sling. And
thank you, doctor.
Okay, it's great to hear from you. I hope that she's great. How does she live with you?
Oh, I'm staying with her because my father passed away a year and a half ago.
Sorry, but thanks a lot for calling.
Thank you so much, and God bless you. Thank you so much.
Bye-bye.
Well.
Joanne, we've already had one Joanne. Hi, Joanne.
Hi, how are you?
This is a new Joanne, right?
Yes.
Where are you calling from?
I'm calling from Brooklyn.
Which part?
City Line near East New York.
Oh, I'm not that familiar. City Line near East New York.
Yes.
Is there a nice restaurant down there?
Yes.
Which one do you recommend?
On Cross Bay, Lenny's.
Oh, that's not London Lenny's, is it?
No.
No, Lenny's.
Yes.
What do they serve?
Italian food.
Delicious, huh?
Yeah.
What is it, Northern Italian?
All different types of Italian.
Very nice. So we're going to go in there. We're going to put that in our book at the end of the year.
Okay.
Okay, what can we do for you?
Yeah, I have COPD, and sometime when I breathe, my lower back be hurting me. Could it be from the disease?
Okay, let's ask Dr. Saleh what he thinks.
Hi, Joanne. I hope you're feeling better. The fact that you have COPD usually shouldn't cause back pain. As we were saying earlier, if you have osteoporosis, particularly if you're on prednisone, which is a drug that we use to treat COPD, sometimes that can accelerate the osteoporosis. So back pain in and of itself isn't part of COPD. Now, there are some exceptions. If you have pain on one side of your chest when you take a deep breath, that may be a lung problem, but just low back pain in and of itself is not related, likely not related to your COPD.
No, because the last week the doctor put me on prednisone, and like it been hurt, my lower back been hurting me.
Right. So if
I take Spiriva.
Okay, Spiriva is one of the agents that we use for COPD. Are you still smoking?
Yeah, and I need to stop because I'm killing myself.
I think more than anything, that should be your first step to stop smoking.
Yeah, but my building collapsed. I was trapped in the building. Me and my daughter, we lost everything. I'm under post-traumatic stress, and I just can't seem to get it together no more.
I know, well, certainly there's a lot of stress you're under, but there are other avenues and other ways to deal with that stress. Smoking is going to end up, trust us, just adding another stress to your life. So do the best you can. Maybe there's some groups that can deal with post-traumatic stress, but please try to stop smoking.
No, I'm under counseling for the post-traumatic stress because I'm bipolar and I'm in a depression.
Oh. So are you living with relatives?
Yes.
That's good. Do you have the support?
Yes, with my children, because my building collapsed.
Terrible.
And
Where was that building?
Trapped in the building.
Where was the building?
A year ago in East New York, the man died underneath the building.
I think I remember that.
Yeah, well, I was all over the news and all in the newspapers. And in one second, my whole life turned upside down. It left me and my daughter, we couldn't even go in and get nothing. The building commissioner, she ordered them to demolish it. That's how unsafe. And it left me and my daughter homeless.
But look, you got a new life.
Yes,
right?
I have life. I'm alive, thank God. But I really need to take care of my health. I know I had to lose weight. I've been losing weight. I've been on the green tea because, like they say, the extra weight puts the arthritis on your knees. So I've been losing weight. I'm still in the process of losing weight. It's just, the smoking. I have to stop it.
Dr. Saleh, are they giving away the smoking cessation aids now?
Yes.
Where can she get that?
You could see the patches to help with smoking cessation. Just the patches are no guarantee. You have to be motivated, and Lord knows you've had an awful lot of bad things, but hang in there, be strong. You have, as Dr. Garner said, your life back. Try to now be positive and put your energy towards healing yourself.
Are you going to call? We're going to hear from you next week, I hope, and tell us that you're stopping?
Yes, I go to Methodist Hospital. One of you doctors I seen on the TV are associated with Methodist Hospital.
Yes, that's correct.
What department do you work in? The lung department?
Dr. Saleh works in the lung department. Dr. Parvin works in the medicine department, and I work in the radiology department.
Oh,
so you stop by and say hello.
Maybe I should make an appointment for the lung department.
Well, your Dr. Saleh's number's there, and you can reach his office to make an appointment. But we look forward to hearing from you next week, okay?
All right, thank you.
Take care. We go to Anna now in line 3. Hi, Anna.
Yeah.
Anna, hi, where are you calling us from?
Manhattan.
Oh, another Manhattan caller. Which part?
3rd Avenue, uptown.
Uptown. It's nice up there, huh?
Yeah.
Living one, it's beautiful buildings I saw with swimming pools and really nice.
Oh, yes, a lot of those.
Yeah. So what can we do for you?
Well, I have a heart condition which my cardiologist say it's syndrome X.
Okay.
But I understand that is something they say when they don't know what it is. I don't know. The thing is, it gives me a pain in my chest, and sometimes it goes up my arm or up my gums, and it lasts maybe 15, 20 minutes, I don't know. So, but I get it now very rare, it's like 3 months now since I haven't the pain.
So Anna, I'm going to ask Dr. Parvin to talk a little bit about cardiology and some of the pains you're getting in general. How old are you?
Maybe it could help me, and I have arthritis, so I just had a knee replacement last year.
So we'll also get Dr. Garner to pitch in. How old are you?
84.
Oh, very nice. And are you overweight or just right?
I was, but after the operation, I lost about 20 pounds, and I seem to put on a little more. I'm not too overweight, but...
Okay, so Anna's having some pains and so on. What should she be worried about looking for in heart-related problems?
So in terms of heart-related problems, obviously the classic is just the crushing chest pain, and we do see that often, and pain radiating down the left arm, which is the sort of classic sign of a heart disease. But it's important, and more important, it tends to be in women or diabetics, people have different sorts of diseases, that they have what they call atypical, but for them might be typical heart pain. And these can be, Anna, did you say you had pain in your jaw?
Sometimes I would get the pain like in my gums when it starts.
Okay, because that can be a sign of your heart feeling a strain.
But you know, I had like 3 angiograms and they can't find what it is.
Okay.
And twice they sent me to that one of the doctors said, oh, it's not heart. You don't have anything wrong with your heart. Go to another guy, and I went to a gastroenterologist who they sent me to. And same thing, and that's been going on for years, and nobody, they can't do anything about it.
Interesting. I mean, can you rule out heart disease? You know, does she definitely not have heart disease, or can we say that?
An angiogram is a good test because you actually see the vessels of the heart. When they do an angiogram, they put dye in through your arteries, and they take a look at the vessels of the heart and make sure that there's blood flow going through to all the vessels and all the small vessels.
But that doctor told me, he said, don't come back here. There's nothing wrong with your heart.
That's good.
But then my regular doctor sent me back to him after another time.
But I'm going to ask Dr. You talked about arthritis. Could that be involved here?
Certainly arthritis could be involved, and that can cause pains over the entire body, including in the jaw, because the jaw certainly is a joint. You know, it's interesting. We were talking about a syndrome called fibromyalgia before, and you said you've had these pains for many, many years, Anna?
Yes.
And you've been...
from about, maybe from I was like 40 or 50.
Okay, and you're 84 now, you said?
I just had it operated in May last year.
Okay. Well, one of the interesting things is we spoke about a syndrome called fibromyalgia, which is a chronic pain syndrome, which many people have. We also spoke to a woman earlier tonight who's bipolar, who has depression. And you know what the most common cause of overwhelming body pain is? It's not arthritis, it's not heart disease, and it's not lung disease. It's depression or stress. Do you have any kind of stress in your life?
Well, the regular, like anyone else, I think, but nothing major.
Okay, and you don't feel depressed?
Because I live alone. I don't have any wife. When I go and see my daughter sometimes and come back for a while, but...
Okay, because quite often that's something which is a cause, a stress, which we may not even know is occurring, or depression, which can cause pain. So that's something you may want to discuss with your doctor. And certainly it's reasonable to see a rheumatologist, since you do have a history of arthritis in the knee where you had to have a knee replacement. So it might be useful to look for arthritis in other parts.
No, but you know, I had arthritis in my fingers and all over, but the ones on my fingers went away.
Well, I'm glad to hear that.
Yes, they wanted to give me injections, so I wouldn't take it. And then in the wrist, they told me I had arthritis also, and I didn't take it. So they said, well, take vitamin C. That might help. And I was taking vitamin C from before by myself.
So, Anna, I want you to call back next week. Next week, call back. We're going to do part 2, because they're long questions.
Okay?
We'll talk to you next week.
I remember that's one thing. My memory is so bad.
Thank you. We'll see you next week.
Okay.
Now, before we go on, I see Monsignor Bennett sitting out there. 8 seasons that he has not missed a show. Monsignor, nobody seems to be able to get this this quiz here. Let me repeat it. See what you think.
I didn't hear what the
Anna,
quiz
Anna, thank you. We'll see you next week. Okay. What word in the English language is always pronounced incorrectly? It's not extraordinary. Okay, Monsignor, so you want to think about that? Maybe somebody will get it. I see we have Joel on line 2. Joel?
Hello?
Hi, Joel.
Hello?
Yes, Joel.
Yeah, this is Joe Style.
Joe, how you doing?
All right, who's this?
This is Dr. Garner. How are you?
Oh, great. I'm doing great. I wonder how you're doing. I haven't heard from you anymore.
I know. We're going to talk. Joe Style.
Yeah, I got to get together with you. Listen, doctor.
Yes, sir.
I had that lump about 6 months ago near my thyroid, like a tumor.
Yes.
And I went, and one of those big X-ray guys sent me to a guy to get a computerized biopsy, and I went, and that saved me from going. Now I'm going to have to go back to him again to see if it changes the size. All I don't even know it's there. Well, it's there, but I don't feel it unless I see it in the mirror. But I was worried about my thyroid and my carotid artery, but they're not bothering me at all. I breathe good. I do everything. So I'm going to go for another test.
Joe?
You know,
one of the most dedicated callers works at community hospital on the board.
I'm still with community. Yeah, we're doing great there.
That's great.
You know.
And I'll come by. I would like to have lunch.
30 years on the board now.
30 years. And how old are you?
91.
91.
Wow. 91 on the run.
We'll get together for lunch?
Oh, yeah, I'd like to do that one day.
Who picks up the tab?
There's a lot of things I can tell you.
Okay, we'll see you. I'm going to pick it up.
All right, I'll call you at the office.
Take care. Be well. Let's go now to Carmen, who's been holding patiently. Carmen?
Yes.
Hi, we're sorry to keep you waiting.
That's okay.
You have the answer to the question?
The answer to what question?
The quiz question. What word in the English language is always pronounced incorrectly?
Extraordinary?
Oh, no. That's what Monsignor thought. No. Where are you calling from?
I'm from Queens.
Queens, which part?
Glendale.
Glendale, nice neighborhood, right?
Yeah.
We like that. So what can we do for you? You have a good bake shop there, right?
Excuse me?
The Glendale Bake Shop?
Yeah.
Yeah. What can we do for you?
Okay, I've been suffering from panic attacks for many years. I've been to therapists. I've been put on medications. And nothing is working for me.
Okay, so panic attacks, a tricky one. What do you think of that, Dr. Parvin?
They are notoriously difficult to treat, as you're finding. Have you been to different therapists, or?
I've been to different therapists. I've been put on many medications, and a lot of the medications that they have put me on are, upsetting my stomach.
It's a tricky one. Are you seeing a psychiatrist?
I've seen a psychiatrist and a psychologist.
Because it can be helped. I mean, it can prevent people from going outside. It can be tricky to treat, but it's something that can be helped and can help you to live a normal life. So,
right, because mine, I have a lot of phobias as well.
It take a longer time to treat sometimes. You kind of have to stick with the therapy. And just sort of, there's a lot of behavioral modification they can do, but they are sort of longer term treatments that really take a lot of motivation and dedication, and a good match with your therapist and your psychiatrist that you both feel comfortable
Carmen,
with
if you call tomorrow, you can call me at the hospital and we'll give you a referral to a doctor who specializes in that.
Okay, and okay. I have two other questions, if I can.
Just quickly, because we're running out. Let's hear them.
Okay, my daughter's 18 years old. She's been with asthma since she's 3. Are there any home remedies that I can give her?
Dr. Saleh.
Hi. I think with asthma, and in terms of home remedies, education is the best medicine of all. So make sure she's taking her maintenance medications. There's a variety of them that I'm sure her doctor is prescribing. And of course, a good home environment, less dust, fumes around the house. So I would definitely say make sure she takes her medicine. That will be very helpful.
Carmen, we're going to get to question 3 next week, okay? You'll call us back.
Okay, thank you.
We'll talk to you. Now we're going to perhaps our last caller of the evening, Simal.
Yes.
It's a beautiful name. What does that mean?
I think it means strong.
Strong is good. Where are you from?
I came a long time, 15 years ago, from Belarus.
Oh, Belarus. And do you live in Brooklyn?
Yeah, I live in Brooklyn.
Oh, do you like the boardwalk there? You like to walk on the boardwalk?
Yeah.
Me
yeah.
too. I enjoy that. It's a really nice place. For those who haven't walked there on a Saturday night and a warm summer night,
Yeah.
to 2, 3 in the morning, people are out walking.
Yeah.
What can we do for you?
Doctor, I have a problem with my foot, with my right foot.
Okay, what's the problem?
The pain is a sharp pain goes from the knee all the way to the top.
Okay, we're going to do a quick
And
answer.
I feel pain in my hips also. Even when I sleep, I cannot sleep on one side, on the other side, and I feel I can't.
Just in the interest of time, I'm going to jump in because I know we have very few minutes left.
Yeah,
and
I know.
What you're describing is a very common problem as far as the sleeping, and that's usually bursitis in the hips. When you lie on one side, and what the bursae are, around every joint in the body, there are fluid-filled sacs, and they serve the same purpose that shock absorbers do in a car. They absorb shock. When they fill up, they can fill up like little water balloons. Usually it's because we've gained some weight or we've injured ourselves. When they fill up with too much fluid, it presses on the nerves right on the hip when you lie on it. If you go to your doctor, he or she may be able to help you either with medication by mouth or injections to the area or pain patches. Does that answer your question, Seema?
We're going to talk to you next week also if you want to call back. Let me get to the last call. Mercelin?
Yes, I'm here.
What kind of a beautiful name is that?
That's a Trinidadian name.
Trinidad, really? What does it mean?
Well, it means beautiful.
It is. It is. Sounds a beautiful name. What can we do? We have only a few seconds. Can we? Let's try and answer your question quickly.
Okay, I have the doctor diagnosed me as I'm having CHF.
Okay.
And they did the CAT. I went through that about 3 times, and they told me that nothing is. The muscles from my heart was weak, and they had me on the Holter monitor for like about 3 months, and I have arrhythmia.
What's the question? If you want to phrase it, what's one question we could answer?
Yeah. So I want to know because my heart keeps racing all the time.
Okay, we're going to get Dr. Parvin. It seems to have gone through all kinds of tests, yet still has this arrhythmia, the heart's racing. Any couple of quick thoughts?
Well, one, it sounds like you have a good, thorough cardiac workup that you've undergone. And a lot of it, when we deal with these arrhythmias, is managing the medications. And there's things you can do with the doses and maybe adjusting your doses. So you should explain to your doctor how you're feeling so that they can maybe adjust some of the medications you're on.
Marissa, I hope that helps you. I see we're squeezing Geraldine in. Geraldine?
Yes. This is a recording.
Do you have an answer for that quiz?
Yes, I think it's...
Oh, this is a cliffhanger. You think it's what?
Receiver off the
You
hook.
think the word correctly?
Main telephone and
It's what?
The word is incorrect.
Absolutely right. There's pandemonium here in the studio. Monsignor's jumping up and down. I can't believe it at the last minute. Geraldine got so worked up, the whole phones went dead. Geraldine, I want you to call in. We're going to mail. We need your address. You're getting the plaque. Just brilliant job. The answer was incorrectly. Took everybody by surprise. Well, that's it for this edition of Ask the Doctor. I'd like to thank Dr. Parvin Zawahir, Dr. Anthony Saleh, and Dr. Bruce Garner for coming in. We hope that we were able to help you. It is good to remember that you should be proactive about your health. Speak to your doctors about your concerns. Go for second or even third opinions. In the meantime, continue to watch this show every Tuesday night or visit the website at www.netny.net/askthedoctor. There you can do many things like watch my special video blogs, see past episodes, or send in questions. Thank you for all your calls tonight. I'll see you again next week at 8 p.m. Goodbye, stay healthy, and I'll see you in the tablet.